So hello friends, today let us see about the fontanelles. So at birth there are total 6 fontanelles. Dr. Jagdish, can you zoom in? So there are total 6 fontanelles at birth. There is one anterior fontanelle, one posterior fontanelle, and two anterolateral and two posterolateral fontanelles. The anterior fontanelle is the largest and most important fontanelle, which is rhomboid in shape or diamond in shape. You can see the rhomboid or diamond shape of anterior fontanelle. And these anterolateral fontanelles are a pair of sphenoid fontanelles. You know that there is being of sphenoid hole. So these two fontanelles are sphenoid fontanelles, which are present at the junction of temporal and coronal sutures. And there are two posterolateral fontanelles. The mastoid process, you know, it is behind the ear. So there are pair of mastoid fontanelles at the junction of temporal and lambdoid suture. In this diagram, you can see the various sutures. So first of all, this is the coronal suture, and this is the sagittal suture. Posteriorly there is lambdoid suture, and anteriorly there is metopic suture. And there are two fontanelles which are important. First is the anterior fontanelle, which is diamond shape or rhomboid in shape, and it closes at 7 to 19 months, and on an average we can say 18 months. And this posterior fontanelle is closes at the 2 months of age. And this posterior fontanelle remains open in cases of Down syndrome, congenital hypothyroidism, this is the important condition, and hydrocephalus. And this anterior fontanelle usually closes around 8 months, but there is delayed closure, which is seen in some conditions such as congenital hypothyroidism or cretinism, then achondroplasia, congenital rubella syndrome, Down syndrome, hydrocephalus, IUGR, rickets, trisomies such as trisomy 13, 18 or 21. Whereas the early closure of anterior fontanelle is seen in two conditions, that is the craniosynostosis or craniostenosis and primary microcephaly. So let us see what is craniosynostosis. So craniosynostosis is premature fusion of one or more cranial sutures resulting in abnormal head shape. So there are various head shapes because of the early or premature fusion of the various sutures. So primary is because primary craniosynostosis results from primary defect of ossification, whereas secondary craniosynostosis is because of result from failure of brain growth. So let us see this craniosynostosis leading to various shapes, giving various shapes to the skull. So there are important 5 deformities and the sutures involved in the deformities. So let us see one by one. So if there is in anterior plagiocephaly, there is respective closure of respective side suture involvement of coronal suture. So this coronal suture is involved in anterior plagiocephaly.